Good morning, everyone. My name is Melina Davis. I'm the CEO and the EVP of the Medical Society of Virginia. Welcome to this morning's COVID-19 vaccine update, covering frequently asked questions about third doses, boosters, and vaccines for children 5 to 11. We're pleased to partner with the Virginia Department of Health for this morning's webinar. I would like to start off by welcoming our speakers, Dr. Danny Avula, the Director of the Richmond Henrico Health District and COVID-19 Vaccine Distribution Coordinator for the Commonwealth of Virginia, Dr. Chris Gaia-Magami, who's Professor of Emergency and Internal Medicine and Senior Advisor to the Executive Vice President for Health Affairs at the University of Virginia, and Alexis Page, who's the COVID-19 Vaccine Pharmacy Coordinator at the Virginia Department of Health. Thank you all so much for joining us this morning and ensuring that MSV's physicians and PAs receive necessary COVID vaccine updates. Pretty vital to our healthcare system. A few housekeeping items. If you'd like to ask a question, please utilize the Q&A function at the bottom of your Zoom screen. If your question is not answered during the webinar for some reason, please just email the MSV team at memberservice@msv.org. We'll add it into the chat so you have that email address just in case. As is the case with all of our webinars, the session will be recorded. I think we're currently in record mode, and then we'll post this to our website so you or anybody else can view it when they have time. Thank you all for attending this morning, and now I will hand the floor over to our guests.
Hey, good morning, everybody. Thanks so much, Melina, and thank you all for being here this morning. I always love that slight hesitation before someone has to pronounce Chris G's last name, which is why we all just call him Chris G. But most of you know him at this point, and he's been really integral to the vaccine rollout over the last few months, in addition to a number of other elements of our COVID response at the VDH level. And Alexis is a new face to the VDH team. You all probably know Stephanie Weewill, the Director of Pharmacy for the state, and she's recruited Alexis on to really focus on the COVID work so that Stephanie could handle all the other responsibilities of the state pharmacy. And Alexis has been amazing and a great connection to our pharmacy community and now to our broader provider community. So I just want to start by thanking you all for what you have been managing really over the last 18 months, but even more acutely in the last few months. You know, I think June and July, things were feeling really good. We were seeing really low case rates. And it felt like we were going to start to make our way out of this. And I think obviously the Delta variant had other ideas, and as we probably should have anticipated better given the epidemiologic curves that we saw in Israel and the United Kingdom and other places around the world. A couple months later, here we are. And I think part of what is really disheartening about that is that the acute impact of the Delta variant in terms of cases, hospitalizations, and deaths was completely preventable. And I think you all share some of that frustration and angst, knowing that if we had better uptake of vaccine, you guys on the front lines wouldn't be having to kind of do this all over again in hospitals and in your practices. And now we have kind of a new and challenging element for our pediatricians and family physicians who are really shouldering a lot of the burden of testing and guidance as kids have returned to school. And there's just a whole host of new protocols in place to try to keep kids and teachers safe. So there's a lot we're juggling. It does kind of feel like a similar intensity to other stages of this, but I know you all are feeling that, especially as you care for patients in the hospital setting or try to guide your patients in the outpatient setting. So really appreciative of your work and your partnership. A lot going on. So we'll talk a little bit about boosters and third doses and some of the epi today. And Chris will jump into that, and then there'll be time for questions at the end. Chris?
All right, great. Well, thanks, Danny, and welcome everybody bright and early this morning. So as Danny said, we're still dealing with the Delta variant, but it looks like we're seeing some signs of good news. At least we're calling it a plateau right now in case rates, and it looks like a trend towards a decline. So hopefully we'll see a nice decline over the next 4 to 8 weeks, and be prepared to get through the winter here. So I know all of you really pay attention to all of the news coming out of the CDC and FDA regarding vaccination updates and approvals. And so today we wanted to go ahead and give you the latest information on third doses, boosters, and what we know so far about children ages 5 to 11. So if you bear with me for 30 seconds, I'm going to share my screen, see if we can make this work. All right, hopefully everybody can see that. Alexis, am I doing okay?
You're up, Chris. Yeah.
Doing great.
Okay.
Right.
All right. So as we said, we're going to try and cover third dose recommendations, booster shot evidence, and just make a couple of opening comments right now about ages 5 to 11. So in terms of the approval process, we understand that Pfizer has submitted information to extend the approval to ages 5 and 11. However, we keep hearing different dates on when we think that will come to light. So currently, we are thinking somewhere near the end of October or possibly early to mid-November. So maybe a 2 or 3 week window of time. And this will allow us to start doing some planning with our physician groups, hospitals, and importantly, schools in terms of having plans for some amount of school-based vaccination where the school districts want to do that, but also in the health departments. So the other vaccines are not quite there yet. Moderna has always been lagging a little bit behind in the timeline. And then J&J, of course, has not been approved for younger children anyway. So we have all eyes on Pfizer, but we really don't expect to hear much for basically another month or so. So let's talk about third doses here for a minute. Now, the CDC has tried to establish some language around additional doses after the first 2 in the initial series. And we're using the term third doses for people who are immunocompromised. And the reasoning around this is because we've tried to now establish the definition that a 3-dose series is the initial vaccination series that's going to be required, certainly recommended for immunocompromised folks. So this guideline you're probably familiar with because it's been out for 3 weeks or so already. And this is a great example of how these things sneak up on us. The ACIP, which is the advisory committee to the CDC and FDA, met on a Thursday, and then on a Friday, this thing was approved, and we were off to the races. And we saw a lot of folks head to their pharmacies or ask their doctors about these third doses. So just a little bit of detail about this. The timing is recommended no sooner than 28 days after the second dose of the Pfizer vaccine. And this third dose is actually recommended for any person who's received 2 doses of either of the mRNA vaccines. So whether that was Pfizer or Moderna, the recommendation is that they get a third dose of the same vaccine they started with. However, if that's not immediately available, FDA says it's okay to mix and match a little bit. And if you have a Pfizer person, they can get a Moderna dose. If you have somebody who has had 2 Modernas, they can get a Pfizer dose. So this is a fairly flexible, and we've seen this already taking hold. Tens of thousands of people in Virginia have taken advantage of getting third doses even before the booster recommendations came out. So we are relying on patients themselves, in many cases, to identify themselves as being immunocompromised. Now, that being said, there are actually guidelines on who would qualify as immunosuppressed. And as physicians and other practitioners on the call, I mean, you can see these are basic common sense. We're talking about people who have active treatment for cancer, organ transplants, stem cell transplants, other primary immunodeficiencies, advanced HIV or AIDS, and then people who are on either high dose corticosteroids or immunosuppressant drugs. So that's a fairly well-defined group, but we have taken the position that patients and their doctors should have these conversations, and there's some leeway there, particularly now that we are recommending boosters in higher risk individuals. So we are relying on people to use their best judgment. And when there's a question, we generally think it's okay, go ahead, get that third dose. So fairly straightforward. This has been working out reasonably well. We haven't seen a huge rush of people showing up needing these, and I think we're getting people what they need. All right, so just going right into the booster shot discussion. There was a lot of news last week, and we made a decision at VDH to go ahead and try and get a bunch of webinars out on the books to all of our physicians in the state through their professional associations early on. So, we've got just initial information, and we know that not everybody could attend because we put these together at short notice. But we felt it was important to try to start educating and be transparent and be available for questions as we go. So I will go through this, and then I see some questions starting to populate in the chat, and we'll get to those in just a couple minutes. So let's just talk about the evidence just for a couple of minutes. I know it's early in the morning, but this is a pretty sophisticated audience, so I think you'll follow along with me. So when we talk about the evidence for giving a booster shot, now booster shots are being defined as an additional shot that's some months after the primary series to give more immunity when we're seeing waning immunity in patients who had the first two doses. And we're going to concentrate really on Pfizer in this part of the discussion, but I think we can all imagine that the Moderna probably follows suit here. So right now, the FDA guidance is only for people who have received 2 doses of the Pfizer vaccine. So what does this evidence really look like, and why did it seem there was a need to make a recommendation? So lots of people have been around the world have been following closely what the vaccine effectiveness, on these slides it's abbreviated VE, so that's vaccine effectiveness, has been for prevention of symptomatic infection, for hospitalization, and then associations with death. And we're going to go through a little bit of this. And you can see here that in the green we've got the pre-Delta period, in the red we have the Delta period. That in all these patients, in all age groups, we started out with a very high vaccine effectiveness in the mid 90% range. But within 60, 90 days, you start to actually see that kind of coming down. So that's one factor, which is time. Now, as we've gone through the summer now, and we've seen the Delta variant become the dominant strain, we've also seen that trend in decline in vaccine effectiveness has continued to go forward. And you can see that these numbers actually start sounding more significant. So you go from a 95, 97% vaccine effectiveness down into the mid 60s. And so I think this was enough of a spark that said, okay, really, can we look into this further and see which groups, if we have to be selective, would be appropriate to get a booster. So a few different cohorts here that I'll go through. This is a cohort of patients in New York State, several thousand patients. And again, looking at vaccine effectiveness versus infection, you can see that over time, same thing, same pattern, that start in the mid 90s, and this one starts fading down into the mid 70s, just after a few months. So these people be about 3-4 months out, and you're seeing a little bit of a decline. But you could make the argument, this is just infections. Is this something we're just going to have to live with? How bad is that? Well, the next one was looking at hospitalization. And so I think we would all agree, particularly looking at this Delta surge, that hospitalization has become really the next critical issue in terms of people's health, of course, but also the functioning of the healthcare system and utilization. So when you look at this data from New York, which really starts in the summer, and we can imagine has continued to show a similar pattern, we see that, again, hospitalization out of the gate, really great vaccine effectiveness at the mid-90s. But then you see this yellow curve a couple months out, and that yellow curve is the people aged 65 and older. And so it may not seem like a big dip, but if you go from 95% effectiveness to about 85% effectiveness, that's a lot of people when you extrapolate this across the whole country. You're talking about millions of people, and then tens or if not hundreds of thousands of people who would be susceptible to need hospitalization. So again, a big signal here, even though it looks like just a little curve. You can see that this decline actually coincided with the increase in the Delta variant. So two things, time and Delta. So let's look at another couple of cohorts. Here's not just New York State, but a sample of patients from several states, a lot in Indiana. We've got folks in Colorado, Utah, California, and the Western states here, about 74,000 people in this observational study looking at vaccine effectiveness against hospitalization. So this is really real world data. This is not in the setting of a clinical trial. This is more registry related, coming from those state health departments. And you can see that that same effect of starting with vaccine effectiveness, 93%, actually declined during this Delta era down to 78% in this real world cohort. So again, that's a fairly significant drop. And of course, that's only 5 months out. So we don't even know, if we project that out even farther into the future, how far that this vaccine effectiveness would drop. So pretty good evidence in a real world population that the clinical immunity from the 2-dose mRNA vaccines, in this case Pfizer, started to decline after about 5 months or so. What about healthcare workers? We've talked about environmental and occupational exposures. And what's the evidence there? There was a cohort, again, observational, looking at healthcare workers and about 4,000 healthcare personnel and first responders across the country. You can see selected cities. And same thing, we're looking at infection in healthcare workers. And you can see that over time, again, you start with a fairly high vaccine effectiveness, 85% in this group in the first 2 weeks to 2 months. And then that starts to decline. But look at this panel below. You can see in the Delta era, that decline even becomes more significant, down to 66%. So I don't think anybody's feeling really great about a 60% vaccine effectiveness. And so again, this is not in high risk individuals based on their medical condition. This is based on their occupational risk. Now, this is just infection. This is not hospitalization. This is not mortality. So there are some limits to this data as well. And I think that the limitations in the data were what caused so much discussion and subtle differences between the FDA's initial impression and then what the CDC came up with at the very end. So here's just a figure that compiles all of the things I just talked about. And you can see that people aged 65 and older had declines in protection for both hospitalization and infection. People with underlying medical conditions, there's some mixed data here, and mostly on hospitalization, but there is some suggestion that people with high-risk medical conditions would have some declining immunity. And then, of course, that frontline worker group for infection seem very statistically significant and clinically significant. So where did this leave us? So 65 and older, we really think that there is a significant decline in vaccine effectiveness for preventing infection and hospitalization. And that the Delta variant seems to make this significantly worse. Individuals with underlying conditions, mixed data, and then folks with occupational exposures, there is definitely a decline in vaccine effectiveness for prevention of infection. So here's the punchline. The current CDC recommendations that came out just a few days ago are the following. So, and there is some wordsmithing in here that I want to make sure that we call out. So for people aged 65 years and older and residents in long-term care settings, CDC says they should receive a booster shot of the Pfizer vaccine at least 6 months after their primary series. So that time window is pretty important. We're encouraging people to make sure they wait until at least 6 months. But at the same time, you do have some immunity. So it's not an emergency that people go at exactly 6 months and 1 day mark to go get their booster vaccine. There's a window of opportunity where they can get that vaccine. So that's 65 and older. The next recommendation, also a should recommendation, is for people aged 50 to 64 with underlying medical conditions. And we're awaiting more detail on this, but again, as physicians and other medical professionals, these are things that I don't think you have to scrutinize too much. If you have someone with a serious medical condition and they're in this age group and they are interested in the vaccine, basically we're encouraging that. Now the next two get a little more fuzzy because the evidence isn't quite as strong, and CDC came out with a may recommendation. And so that's for, excuse me, people aged 18 to 49 with underlying medical conditions. So they may get a vaccine. And then it also really should be based on that conversation between the individual about the risks and benefits for the vaccine. And last but not least, a similar recommendation for basically 18 to 64 with occupational risk. And so we're talking about frontline healthcare workers, folks who work in congregate facilities, people who have a lot of exposure to the public, that again, they would be eligible for receiving a booster of the mRNA vaccine. So there's a lot of material that we've covered, and we will be happy to take questions. And I'm going to just flash up this advertisement in the meantime that we are still promoting teletown halls for anyone who would like support on that. We have the materials, we have the technology platform, and you can email us and we'd be happy to help sponsor a town hall for you to be able to talk to your patients directly. We can be in the background, we can assist with that, however you want to do. So at this point, I'd just like to hand it off to Alexis, who is our pharmacy lead, who can fill in some of the gaps and make some general comments, and then I'm happy to take questions.
Thanks, Chris. So as everyone's preparing for booster doses and, third doses, I'm sure there's some concern about whether or not you may carry Pfizer and being able to order or offer that to patients who need a booster dose. So I just want to put a plug in for something that we have at the pharmacy at BDH. So we have a program called the Small Shipment Redistribution Program, which is SSRP. And so that allows providers to order Pfizer vials in smaller quantities than would necessarily be allowed from the federal government. So providers can order vials from as few as 1 vial all the way up to 60. So that allows providers to have Pfizer on hand and not have to worry about ultra cold storage. And that way we can reach more patients, therefore, and by allowing providers to have Pfizer on hand. So if you want more information, hopefully you're familiar about SSRP, but if you want more information, I'm happy to fill in any gaps as well.
So while we're keeping an eye on the chat, if there are any questions, I'll just ask Alexis, so in this phase of our vaccine response, we're in a really different place than we were in January. Back in January, of course, there were shortages of supply, and mostly local health departments and hospitals had the vaccine. What does it look like now in terms of access to vaccines in the community and the outlets that we've got going?
Chris, you're asking me?
Yeah.
Okay. So there's plenty of vaccine on the ground. We don't anticipate a shortage of vaccine supply at the moment. There are plenty of avenues and mechanisms in place for patients to be able to receive the vaccine. So, there's a pharmacy pretty much on every corner, depending on the community. So patients can be funneled to the pharmacy. They can be funneled to local health district pop-up clinic events, primary care providers. So the access is there. I think we need to promote the communication, making sure that patients are aware that this is something that this is new communication from the CDC. So just educating the population and then educating them on where to go.
I might add a couple of thoughts to that, Chris. So, as I think a lot of what providers have been asking as we've met with different groups is, how do you parse through these individuals with underlying conditions? What does the self-attestation process look like? And I think, as Chris said, and I just want to reiterate that the context is so different. When we don't have concerns about supply constraint, there's just a lot more flexibility and kind of deference to the individual. And obviously, we want to follow the science and practice good medicine. But we also don't want to put up barriers to individuals who do want access. And so if they show up at a pharmacy and they self-attest to having an underlying condition, or they self-attest to being in an occupational risk group where they feel like they're at higher risk, they're going to get the booster. And I know, for the short season with the immunosuppressed population, that caused a lot of primary care docs some angst because, if they knew their patient didn't necessarily qualify, but their patient could go to a pharmacy and get that third shot, that put providers in a tough place. And Alexis has certainly been addressing that with our pharmacy community. But I think the take home for this season is that supply is not an issue. The reason the CDC voted the way they did was, one, to make good science-based recommendations, but also to allow some flexibility for people who are on the kind of the fringe for underlying conditions. So, when in doubt, opt for the booster.
Yeah, and just to tag along with that, over the last several months, we've continued to onboard medical practices and other facilities. And if you have an interest and you're not already onboarded, please just email me or go to the VDH website and we can help navigate you through that process. As Danny said, there's really no supply constraint right now. We're not doing allocation method, and we've made it very easy because the storage requirements have been eased up over the last few months for the vaccine. So you don't need that ultra cold storage if you're going to use the vaccine right away. And we can deliver down as little as one vial to you. So you can minimize wastage, and we do encourage people to get more than one vial, but we're trying to be as flexible as possible. So I see a couple of questions in the Q&A, and I'll take the last one first because that's the easiest one for me, which is, what is the status for boosters for healthcare workers? And so it's basically open season. These are essentially approved at this point for 18 and older. So if you need to start thinking about your own staff, there's a green light from all of the agencies on that. The other question about adverse event rates, I may need to send you some information. What I have seen, and I have a slide on this, I didn't include it in the deck, was that for both the Pfizer and Moderna's, that the pattern of the adverse effects of the symptoms like headache, body aches, low-grade fever, fatigue, were basically the same for third doses as they are for second doses. So, but I can send some follow-up information. Alexis, it looked like you wanted to answer a question live.
Oh, I'm sorry. I just marked that you did answer it. You're good.
Oh, all right. All right. Any other impressions from Danny or Alexis on the adverse event rates? Yeah. So I think what's now been much more time tested, I believe that it's something like 4 billion doses of these vaccines have been given in the world now. And so I think people are starting to feel very comfortable that the adverse event rates are far, far lower than the complication rates from getting COVID. But people do get symptoms, and I think one of the metrics was about a quarter of the people felt like they needed a day off after getting their second dose.
It looks like we also received a question in the chat.
Okay.
Healthcare staff received Moderna for the first 2 doses. Can they get Pfizer for the booster?
Yeah. So unfortunately, right now, the answer to that is no. That is not recommended. So as these studies are done, they're looking at, it's not really the vaccine they're looking at in terms of, they didn't really look at the effectiveness of boosters. They looked at what's the decline in vaccine effectiveness. And so the data that was reviewed by the ACIP and FDA and CDC was in patients who received Pfizer. So I think we all tend to believe that the Moderna patients are going to follow suit, but right now we don't have that thorough evidence review and we don't have a recommendation. So that would be considered off-label use. I think, in the future, I think this is all going to happen. I think that we're probably going to be giving boosters to Moderna patients. I think we'll be able to mix and match. And even a little farther down the line, there's data coming down the pike for efficacy of a second J&J vaccine. But these are probably months away. All right. So we'll give another minute or so, but we know that this is early morning and that people are getting ready for work. We wanted to keep this in the 30 to 45 minute range. So we'll stay on here for another minute or two, but thank you so much for everything that you're doing to help support our residents of the Commonwealth and for your interest in trying to learn more about these vaccines.
Do we have any more questions before we let our guests begin their days too?
All right. Well, thank you to MSV for organizing this in such short notice. And, if you ever need any additional support, just let us know and we'll be here for you.
Thank you guys so much. And thank you everyone for joining. And we will send out the recording and any other materials in our emails this week. Have a great day, everyone.
Thank you.